Bismillah ar-Rahman ar-Rahim, my dear students of Ajman University. Today I would like to talk about a very important topic, and it's one of the essential services provided by Drug Information Center, and that is to answer questions. In today's lecture, we will talk about the systematic approach to answering questions, along with the modified systematic approach to answer questions. What you should be able to do after the end of this topic is that when you are presented with drug information question and you are given the demographics of the requester, and demographics, I mean what is the age, what's his position or what's her position of the requester, and his reference frame or frame of reference. We need to know about him. So after you obtain this question, you should be able to determine pertinent background information by asking the requester some relevant information. Also, once you are able to determine the ultimate question, okay, and you can determine ultimate question if you get good background information about the requester, then you'll be able to determine the ultimate question, and in this case you should be able to categorize the question. I mean by categorizing is what type of information is required to respond to the question. Is it regarding therapy? Is it regarding disease? Is it regarding pharmacokinetics of a drug, etc., etc.? Okay, so you need to categorize the ultimate, the final question that you agree with the requester about. What's his real question, ultimate question? Once you do the search and you evaluate the information to respond to the requester, you need to formulate this response in appropriate way that is relevant to the sophistication of the requester. Is he a lay person or is he a physician? Different type of responses will be offered. Also, you need to determine what type of questions that warrant the follow-up. Yani, for example, let's say you responded to a question and maybe after a couple of days you again contact the same requester and follow up with him to see if everything is going well. Also, according to the practice setting, what do you expect as a question, potential question that can benefit from the modified systematic approach to answer the question? So you will see that we will talk about today about two approaches. One is the systematic approach to receive the question and answer it, and the other one is the modified systematic approach. I'm not talking here about the specific item. If you remember, we start with tertiary, then secondary, then primary. I'm talking here about how to handle questions from the requester. Okay. The first one to present a systematic way to respond to question was Watanabe et al., and that was in 1975. He gave steps in order to answer questions, and mainly he did that in order to instruct his pharmacy students on how to handle questions. So he said, okay, how am I going to teach my students how to handle questions from requesters? So I'm going to develop steps so it can facilitate for them and to take the question and respond, and at the same time I'll be able to evaluate the students. So it has been used also in training pharmacy students and practitioners. Uh, طبعا وتنيب et al. He expanded his steps and he published a textbook in this matter, and this textbook was used for so many years, and the principles of this systematic approach were allowing to quality assure the drug information service and to train in drug information skills and to enhance the program. Later on, طبعا with the technology, things has changed, and now we have also the modified systematic approach, which I recommend, and most drug information centers they use this approach to document and to quality assure the information provided. Okay, let's start first with the systematic approach, and that was by Watanabe et al., and it was in 1975. So Watanabe was telling his students, okay, once you receive the question, okay, you will write it down, and then you will need to classify the request. Okay, say whether this request is regarding pregnancy, regarding lactation, regarding therapy, regarding pharmacokinetics, regarding drug ID, regarding drug price, regarding drug availability, regarding general يعني they can classify what type of request is this. And then he was telling his students, okay, after you get the question and you classify it, then you will need to ask the requester and get background information about this case, whether the demographic information or history or disease information with regards to the question. Uh, okay, he was telling them, okay, after you obtain this background information, you can now carry the systematic search. You can, okay, say, for example, since this is about pharmacokinetic question, then I will go to pharmacokinetic textbook, or if it is for therapy, then I will go to therapy. Then if it is about pregnancy, then I will go to Briggs, etc. Okay, so they will do the search, and then they will formulate the response as step number 4, and then according to the information they gathered, okay, and after they respond to the requester, they might reclassify the question type, because when the question is answered, at that point the requester might ask some additional questions, or he might say, okay, it wasn't this what I was looking for. So at the same time, you'll be able from your search to have additional information which will allow you to answer additional questions and maybe reclassify the type of question that was answered. Then reclassification is an opportunity to reclassify after you get the information. If you look here, it assumes that you have little knowledge about drugs, and that's why when the question was given in step 1, you classified it according to the request. You got some background information from the requester. You did a systematic search to get knowledge because you had little knowledge of drugs, and then according to that you responded, and from your search you got additional information that allows you even to answer additional question. Regarding the modified systematic approach, you should know that although here we are focusing on answering drug information requests, you should know that the modified systematic approach can be used in almost every practice in pharmacy, including, by the way, including writing and professional communication, which I talked about in last lecture. So what are these steps اللي هي modified to Watanabe et al. You will see that it consists of 7 steps. So initially you are asked question, and this is called initial question. So you put it aside, keep it, put it aside, and then you start to get demographic information and background information. In some cases, they mix background information with demographics. So when they say background information, they also mean the demographics. But we like here to differentiate between demographics, the characteristics of the requesters. His male, what's his age, what's his job, how urgent is the matter for him, etc. Okay. After you get the initial information about the demographics, then you start taking background information, which you need to know the following. Okay, why? طبعا this is in your mind. You keep it in your mind. Why is the requester asking this question? That's what you need to dig and get as much as information as possible. Okay, so actually you should know that in most of the time the initial question is not as the ultimate question, and this is most of the time. تخيلوا, most of the times what you are asked initially is different from the real question of the requester, which means if you just take the initial question and you go on searching, you will end up not really satisfying the customer. And this is something very important in drug information services, that you should satisfy your customer, okay, the person who's asking you the question. طيب, as I said, you need to get demographics of the requester, see how knowledgeable he is, what training he has, what is his position, how did he get such information. طبعا how did he get such information is regarded as background question. Okay, and one important thing in demographics, how do you like the delivery of the response, how it is urgent. So you might take his email, his phone number, etc. As I said, the background question is very important and it's the most difficult to carry out. Okay, as I told you, what you need to determine is why is the requester asking this information. ليش بيسأل هيك؟ Okay, if you can answer this question to yourself, then you have got a good background and you'll be able to determine the ultimate question. طبعا the way to get this information, why is the requester asking for this information, the way you should do it is in dialogue, مش interrogation or investigative يعني investigation way. No, it's a dialogue يعني between two. You should not force it. Don't tell him why are you asking this question. Don't tell him this. You for example, what you have to ask him is طبعا requester name ولوكيشن كله هذا demographics وaffiliation وفريم اوف هذا كله demographics, but sometimes they put it under background information. Here this starts background اللي هو the resources that the requester already consulted, whether this request is for patient or is it just academic, يعني a pharmacist just wants to know more. What is the patient diagnosis, إذا كان في هناك there is any lab test results, medication being used, anything else, and how urgent is the request. And you might negotiate, يعني you should determine how much time do I need to respond and see whether it agrees with the requester state. Okay. طيب. Now, what you should know is when I ask the requester, what resources did you check? Okay, and what did you understand from these resources? One possible benefit from that is to avoid duplication. I should not go to the same resource because the requester already been to these resources and maybe he didn't find the required information. But you شوفوا, these are two ways, but you might want to double check if you feel that maybe the requester is not able actually either to comprehend the information or to locate the information. Okay, maybe the way the requester understood is different because maybe he doesn't have good medical background, so maybe he understood things differently. Actually, while you are talking about or trying to get background information and having dialogue with the requester, you will be able to see whether the requester is of high level of sophistication, who knows how to evaluate literature. If the requester tells you that, okay, I've been to primary literature and I have analyzed several papers and it tells me so and so, معناته this person has high level of sophistication and you will need to respond to that level. As I told you, in most cases, the ultimate question that you will get after the background information is obtained is different from the it's different from the initial question. What you also need to know, is that if someone calls you and he asks you a question and this question is not related to him, يعني for example, you ask your sister or you ask your friend, okay, can you call drug information center and ask them about my case? So when your friend talks to the drug information center and they start or they want to get background information, here is a problem. Okay, because they are not talking to the end user. uh, Another example is when a medical student, nurse or pharmacist, they also call and they don't have real case to answer, so they may throw twists into the case which will make it difficult for you to answer. So the most difficult questions to answer are those where the end user is not the caller or the requester. So this will create problems to you. So how do you deal with these situations? Okay, someone is calling you, maybe a medical student, and is just throwing twist here and there, and he doesn't have a real case, and it's not about him. Okay, or it's not about what he's going to do with a patient he has. Okay, so how to deal with that? طبعا you can do one of two things: either educate them generally about the case, okay, because you don't have a real case here, so generally educate them about the subject. This is one option. Second option is ask the pharmacist to ask the end user to call directly so that you can get good background information. You must know that obtaining background information requires practice to maintain the competence. Okay, as I told you, it has to be a dialogue sort of scenario. So, what is the ultimate question? As I told you, see, they found in one study that 85% of the questions of the ultimate questions were different from the initial one. تخيلوا. So the majority is different. That's why this will tell you the importance of the background information you have to obtain. طيب, suppose You determine the ultimate question. Do you just stop or do you have to confirm it with the requester? يعني let's say the requester is telling you, will cinnamon be good for blood glucose level? And after discussing what really the requester question is, for example, what food should I take? How should be my diet? Huh? How should be my diet if I have diabetes, for example, is different than if cinnamon will control the blood glucose level. Or maybe the ultimate question is, what is the best medication to manage blood glucose level, which is totally different than if cinnamon will lower blood glucose level. فif you don't determine the ultimate question and you just respond to the initial question, you say yes it does or no it doesn't, you don't satisfy the customer. But if you know the real ultimate question, then in this case you'll be able to satisfy the customer and answer the customer in a better way. So once you determine the ultimate question, it's very important that you confirm this question with the requester. Tell him, is this what you want? Okay. So verify that. Okay, once you verify the ultimate question, then you need to categorize the question as I already explained before, اللي هي what field of information, what area of information, okay? So that you can determine what resources do you go for. And maybe you will determine 2 3 resources. The first one should be the one that you think is most relevant to the case. It should be the most relevant. This will reduce the time needed to locate information. Okay, a search strategy, as I told you, when you categorize the question, then the resource should be regarding adverse effects, and as I told you, you have to prioritize your search. Which one is first do I search? Because if you just go to something that you are familiar with, you might not find the information and then you are wasting your time. So what is the right resource I should start with? طيب, after that you might go to different resources and you might have same information or different or contradicting information. So what you have to do is you have to evaluate the information you get. So look at them all, evaluate them, and apply clinical statistical analysis. That's why you should learn about statistical analysis. So in order for you to have good skills in literature evaluation, you should be also good in statistics. And this actually what differentiate between a good professional, okay, like you, inshallah, and a technician. A technician, he just does the job, but you evaluate everything before you make decision. So what you have to do is evaluate, analyze, and then you need to put together the pieces. طيب, when you put together the pieces, you might not be using the whole information you got. So you'll be responding to the information or to the request or to the question by the requester. Now, how do you formulate the response? Now you putting together the pieces. Now you want to formulate a response. Okay, these are the information required. How am I going to respond? Remember, the best way to respond is as if you are giving a lecture or presentation. Okay, this is the best way. where you have all your evidences in a way بطريقة in a way that the receiver of information, the requester, can comprehend what you are saying and understanding everything. Of course, just like presentation or lecture, usually there will be additional questions, yes, but your response should be satisfying. يعني when you do your response, يعني whoever listens to you should be satisfied, should not have questions in their mind, even though that they might have some questions. طيب, suppose you got contradicting results. Would you go for one in order not to confuse the person, or would you tell the person the two sides of the story? What is good, okay, when you have conflicting data? Okay. uh, okay, when you have conflicting data, what you have to do is the following: present the competing viewpoints or considerations. يعني present both views, okay, whether you support that or you don't. So provide them, tell them this study says like that and this study says like that, okay. Then state the assessment of the literature or information reviewed and claim superior viewpoint. So you have done your assessment and you believe one is better. So you have to tell the requester that this claim is superior from my point of view. This claim is superior. I support this. Why? طيب, now you have to make him convinced. Otherwise, he will tell you, oh, you don't know nothing. You just give me information without really good evidence. Now you tell the requester that every study has strength and weakness, but the weaker viewpoint or the weaker study that you think is weaker will have some strength. So you have to refute these strengths. يعني some study will tell you, okay, we have used 1000 subjects, which are many subjects in one study, so our results are very accurate, okay. But you tell them, okay, you have used many subjects, but is it related to the outcome? Did you do the calculation to see how many subjects are needed? Okay. Or someone is telling you, well, our study is excellent, we have the length of the study was 1 year, and this 1 year we did not discover anything, or we discovered something. So you say, for example, okay, but 1 year is not enough to see the events occurring, okay. So the strength in the weaker viewpoint, and your point of view is that one of them is weak, but this weak has some strength. So you have to talk about the strength and say they are not really good enough, and present the weakness of the inferior uh, uh, viewpoint. And then you go to your viewpoint or point of view, where you say, okay, this is strong. So you defend the weakness of this viewpoint and promote the strength of this superior point of view according to you, okay. So it's like I am saying the strength and weakness of each one, okay. The two viewpoints, I'm talking about the strength and weakness, but the one I support, I will promote the strength and I will defend the weakness, okay. But the one I don't support, I will refute the strength of the one that I don't support, okay, and I will say why I say these strengths are really not accurate, or they are not good enough, and I will talk about also the weakness. Then, and this is important, okay, reiterate the final statement in support of the superior viewpoint. It's similar to step two. State the assessment of the literature or information reviewed and claim the superior viewpoint. هنا at the end I have to reiterate, يعني say again the final assessment in support of superior viewpoint. I hope this is clear to you. طيب, suppose you were supposed to answer in 1 day, but it took you 2 days to answer. Or maybe you answered on time, but it wasn't to the sophistication level of the requester. In this case, it's like you wasted your work. So you have to respond on time and at the level and sophistication of the requester. And this communication is very important because طبعا الverbal communication is the most frequently used method to respond to drug information request. Okay, and if you have a question, what is the most frequent used method to respond to questions? It's verbal communication. Now this verbal communication should be good. You should have good skills in communication. Okay, again, it should be like a nice presentation with excellent evidence provided and convincing. It has to be convincing. You should be confident in its delivery. When you deliver the response, you should be confident, and you should correctly pronounce all the terms, because if you don't pronounce them correctly, you will give bad idea about your service and skills. Okay, so when you give the response, you should expect and be prepared to answer additional questions, and in most cases the additional questions can be answered because when you did your search, you gathered not just information to respond to the question, but you gathered additional information which will allow you to respond to additional questions. So whatever remaining that you did not tell the requester, اللي هي between brackets leftovers or remnants, from them you can answer these additional questions. Okay, let's now talk about follow up, follow through, and documentation. These two terms maybe will be confusing to you, and you should be able to differentiate between follow up and follow through. Follow up is the process of verifying the appropriateness and correctness and completeness of the response, okay, that you provided. يعني it's like, when a customer calls you, this customer is like your close friend, or like your sister, or like brother, or you're like your mother, or you're like your father, or like your son, or you're like your daughter. So the person, you should feel care for this person. Okay, for example, if you gave us a judgment, okay, regarding something that is not really supported by scientific literature, I'll give you an example. Let's say someone is telling you a question. Someone is telling you, I'm not able to break the tablet, so what shall I do? So you suggest for this person a tablet cutter, okay, that can be purchased from the pharmacy. Okay, that's good. So after 2 days, you want to make sure that he was able to get this tablet cutter and he was able to cut the tablets in halves. Okay. Or maybe you gave a dosing recommendation. Someone tells you, when I take the full tablet, I get some side effects. what shall I do? You tell him, okay, take half tablet and hopefully it will work. And instead of taking the tablet once a day, take it two halves, so twice a day. Okay, but you are not sure whether this will be or will give therapeutic effect. Okay, because you have breaking the tablet to two times, so each times is half the dose. So you are not sure whether this is working for the patient or not. So in this case, you follow up. Okay, is and when do you follow up? When the question is specific to the patient. Okay, as I told you, the patient is not able to break the tablet, or there is some side effects if he takes full tablet, etc. So, and there is soft data, يعني there is no clear data to say what to do. So you are giving judgment. In this case, you follow up, and usually follow up takes shorter time. يعني it's not like follow through. Follow up, as I told you, maybe you call the requester maybe after a couple of days, maybe 1 week as maximum. Okay, but in follow through this can happen after really some time. Follow up is considered as good practice. You care about the person, so your service is of good quality. Okay, but follow through is different. Follow through is when you answer a question, and maybe after a few months or a few years, new data appears, okay, that change your perspective of the answer. يعني you said, for example, okay, drug A will be better for you, but after 1 year, a study came and said, no, drug A will cause renal failure, and renal failure is very significant adverse effect. Okay, in this case, you want to change your mind. Okay, so you need to follow through. Okay, is and follow through is the process of readdressing a request based on the availability of new data or change in the situation or circumstances that were decisive factors in the synthesis of the original response. Okay, for example, you recommended a therapy, novel therapy, new therapy to a patient, but there is a new article that appears saying that there is the development of renal failure. Okay, type if the requester continues with the novel therapy, he will have renal failure. It's possible. So shall I leave this person to have renal failure, or should I follow through and tell him, well, there is a new study, and according to this new study, it's better to go back to your original medication. So follow through and follow up are considered as good practice. Okay. Uh, documentation is essential. Almost in every institution, in every organization, documentation is very important. For us in academia, we do a lot of documentation to get accreditation and to improve your curriculum, etc., etc. So documentation is very important. Now, what do you put in this documentation? Now, it can be different from one center to another. It can be simple or extensive, containing so many parts. The minimum, the simplest one, is it should contain the ultimate question, at least what is the ultimate questions, the material being searched, what is the response, and the follow-up or follow-through. على الأقل these should be documented. But otherwise, the documentation is even more. The documentation, you have to put the initial questions, the demographics, the ultimate questions, the background, the resources you searched, etc., etc. Why documentation is necessary? Documentation is necessary for quality assurance, for protection. If you have a legal case where maybe you are implicated in advising something wrong, and you did not do that, so you have the documentation to prove that. It's also to do a statistical analysis of what is the most frequent questions, what are the new types of questions that are coming up, and this will help to train students on the new type of questions they may receive. If you remember in our chapter 2, drug information resources, we said that dietary supplements and alternative medicine are becoming popular among the questions being asked to the pharmacist. Okay, so these are very important records to keep. Additionally, regarding follow up and follow through, it shows that, if you do follow through or follow up, the customer will be satisfied, and it can be proof that your center is providing service that satisfies the customers, and this will be a good record of achievement. That's why usually the patient or the requester is asked whether he's satisfied or not with the answer, and how much is the requester is satisfied. As you know, this might happen with some of you when they go to post office or bank, etc. They may ask the person to fill uh, a questionnaire, maybe electronic or paper, to say whether they are happy with the service or not. So if you have a record showing that all customers are happy, this, by providing this service that makes customer happy, you can take money, yani charge money for that, okay? Because you are making them satisfied, okay? So satisfaction allows you to earn more money, okay? In conclusion, you should be able to apply a modified systematic approach to receive questions, determine the demographics of the requester, obtain background information, determine ultimate question, categorize the question, do the search, evaluation, and analysis and synthesis, do the response, do the follow up or follow through, and documentation. Okay. Here you can look at these questions, which might help you, inshallah, in the lab session, because we will have lab session, and in this lab session we have form, extensive form for you to fill for each a question, or for a question that you'll be answering in the lab. Okay, I hope this is satisfying. As usual, if you have any question, please contact me by WhatsApp, the WhatsApp group that I have with you. Contact me by email during the lecture. You know how to contact me. Have a nice day.